Okay, so in today's post, I want to talk about a test that is sometimes done to check the cause of chronic low back pain. What it's called is a discogram, and what happens is the doctor will go in, they'll order this test, and they'll go in and they'll actually make a small injection with a very low gauge needle into the disc and insert pressure into the disc, and then they can get a reading to find out if there's a disease process or something going on in that disc that could be contributing to chronic pain. And what they did was they did a follow-up study on people that had received these discograms over a 10-year period, and the follow-up study revealed that there was a very high incidence of increased disc degeneration in people who had received the discograms. Now, the important thing for this is, if you're having chronic low back pain and you're going through diagnostic processes and the doctor recommends that they do a discogram, well, you're going to think, it's a diagnosis procedure. It's not going to have a negative side effect. Well, this study reveals that it does. It actually increases the speed of degeneration in the spine, which is a critical factor because you don't want that spine to degenerate because you cannot get that back. I personally have experienced this degeneration. As many of you know, I had back surgery when I was 24 years old. I have done very well with my back surgery. I've done everything that I needed to do to make sure that my surgery held and that it was a successful surgery. And I did have a successful surgery. I'm not a fan of surgery, but sometimes it's necessary. And I had a successful surgery because of the efforts that I put into it. But I have taken x-rays of myself, and that one level, my L5S1, in spite of everything that I've done, is degenerating much quicker than the rest of my spine. It's probably, I would say, 20 to 30 years ahead of the rest of my spine. The rest of my spine looks wonderful, except for that one disc level. So even a successful surgery, even a successful invasive procedure has led to increased spinal degeneration. So keep that in mind if you guys are ever going through a diagnostic procedure. You need to think about these risks before you have them done. All right, I hope this brings some good information to you, and if you have any questions, feel free to post a comment. And as always, my hope for you is that you take control of your health before your health takes control of you, and we'll see you tomorrow. Have a great day. Bye-bye.